I'm so glad that you mentioned this. The one-to-one is obviously important, but they do not trump the credentialed teacher who oversees their case. Let me explain something. When it comes to credentials and stuff like that, like, we understand the teacher is the credentialed one and usually the caseworker if it's not the sped teacher. But when it comes to a one-to-one, especially in the school setting, let me tell you something. When a teacher has 26 kids in her classroom and 6 of them have IEPs and 4 of them probably have BIPs and 1 of them has a one-to-one, you will be lucky if that teacher, who is the one that's credentialed, is actually spending more than 5 minutes a day with the learner with the one-to-one. If a child has a one-to-one, I'm telling you right now, it's like a break for the teacher, because it's almost as if it's like one less kid the teacher has to worry about, because she knows that that kid has a one-to-one to support them throughout the day. And then whenever it's that child's time to work one-to-one, because the teacher has to pull kids and do progress monitoring off after she has to instruct the whole class of what they have to be doing, sitting quiet while they're doing the worksheet, while she has the time to actually pull kids to actually get her work and stuff done that she has to as the teacher. So when I say the one-to-one knows the child best, they are the professionals on that child. You don't need to have credentials to be a professional on the child. You need to understand the child and know what's their triggers, know what sets them off, know what they're good at, what their strengths are. And then you share that with the teacher, who doesn't have the time she doesn't have the time to stay 6.5 hours a day with the kid to understand the strengths of that child. She's limited, or the teachers are limited with the time that they have, and also the requirements that they should be doing, and the coursework and everything else that they should be teaching the whole class as a whole. Teachers are overworked. And also, let me share something too. Obviously, I was a one-to-one ABA therapist before I became a BCBA. And I'm not sure if you understand, if you want to talk about credentials and education, some teachers, they don't need a master's degree. You can become a teacher with a bachelor's degree. And there's a lot of therapists. Let me explain one-to-ones too. So, and I've been in the school setting for a very long time. There's paras, there's BTs, there's RBTs, there's ABA therapists. And usually the BTs, RBTs, ABA therapists are under the supervision of a BCBA. So the BCBA is a part of the team of that learner. And before you can even get educational content, and we need to focus on the behaviors, because if this kid is having meltdowns and everything all day long and having tantrums, what kind of work do you think they're getting done? They're not. We have to target their emotional regulation, their flexibility. We need to get their behaviors under control before they can even get any type of academics done. How do we do that? Well, we have to figure out the function. Usually it's escape, or the work is too hard, they need extra supports, the work needs to be modified. There's a lot of different things that we could adjust in the environment to set them up for success, so that they're not engaging in these type of behaviors. And we could teach replacement behaviors, which is usually FCT, functionally communicate, so that they express that their needs in that moment, and we help them navigate it, and we give them the supports that they need. So the teachers will then, because they're the certified and credentialed, they should be the ones applying the modified work to the one-to-ones to help that learner navigate and be successful in the classroom. So back to this whole post is, the one-to-one will absolutely know the learner best, 100%. Whoever spends the most time with that learner is going to be the one that should be advocating on behalf of that learner. And then they share with the other service providers, hey, when you ask them a question, the IRT time between responses is usually about 12 seconds. So that just means, and let me tell you something too. When it comes to the service providers, you need to understand the kids are in school 6.5 hours a day, 5 days a week. They probably get service providers on Tuesdays for 30 minutes. You know what the service provider is trying to crank as many programs and stuff. The work and demands in the 30-minute sections are going to be way more than a typical 30-minute session in the classroom. So, they're already, the time constraint with the child to get things done is already limited. So they're going to try to crank out as much as they can to, get their job done, but also to crank through all the stuff that they should be doing. So when it comes to time, it's you don't really want to waste time with service provider. We have a lot of things to get done. We got to progress monitor. We got to do the testing. This is nice. You see what I mean? But having someone that is an expert on the learner, and like I said, you don't need credentials to be an expert on the learner. As long as you understand your learner, you know what triggers them, you know where they need more support, you know what kind of prompting strategies they need to be successful, because that's another thing. Sometimes learners need a partial verbal. Sometimes they need a full physical. Sometimes they need a little gestural guidance. Sometimes they actually need like full follow through support. As the one-to-one, you can share that knowledge with the teachers or other service providers. Like, oh, like give them a couple seconds to or give them an option, or, you're going to help the learner be successful by helping the other service providers learn that learner. And since you know that learner best, you're going to share your knowledge so that everyone else could generalize what you're doing in the natural setting and what he's used to into their sessions.